My name is Brittany Jean-Louis, and the middle range theory that I chose to discuss is intuitive decision-making in nursing. The nursing practice involves a wide range of interactions and elements that are required for standard operation. An elaborate definition of nursing practice involves using middle range theories that help bridge the divide between grand theories and nursing practices. One of these theories is the theory of intuitive decision-making in nursing by Payne. Payne argues that nurses go through several steps in decision-making, which mainly require intuition, especially in handling different patients. The theory suggests that skill gaining informs decision-making among nurses through intuition based on the contextual issues at hand. The theory of intuitive decision-making allows for the individual building of capabilities among nurses to make rational decisions based on their skills and experiences. The theory emphasizes the importance of the nursing experience on informing decision-making approaches in practice. It emphasizes the needs for nurses to make decisions based on skills, allowing for rationality and decision-making based on an assessment of the possible outcomes. The theory helps build individual confidence and experience among nurses by informing their capacity in decision-making. The theory of intuitive decision-making also informs nursing practice across different healthcare settings to improve the healthcare environment. It is worth appreciating the unique challenges and conditions that surround nursing practice, such as evidence-based practice, patient-centered care, and teamwork. The theory goes beyond these factors and influences to suggest the need for decision-making based on intuition, which will allow for improved coordination in healthcare provision. The approach will help nurses cultivate positive and effective working environments that promote effective treatment outcomes. Health is an integral paradigm of the nursing practice because it directly reflects the competencies and performance of nurses to improving care provision. The intuitive theory of decision-making suggests that an increased basis on intuition among nurses positively correlates to improved health outcomes. The use of intuition among nurses to make decisions has backing from skill acquisition, development, and practice over the years. Thus, cultivating the practices from the theory will help improve care provision through rational decision-making processes. The nursing practice reflects the foundation of the profession, which aims at providing skilled and effective care to patients to improve treatment outcomes. A major factor in decision-making for the nursing field is considering the outcome of care provisions, allowing for improved services and quality care. Adopting the precepts of the theory of intuitive decision-making allows nurses to provide care and make decisions on best practices in patient handling based on contextual factors. It informs nursing practices as an outcome-based profession rather than a procedure-based approach to patient treatment. The theory of intuitive decision-making allows for nursing practice centered on the contextual needs of a patient and the nursing environment. As a nurse in the clinical practice administering care to patients from different illnesses and conditions, I appreciate the role of the theory of intuitive decision-making. In particular, I apply the theory's approaches to decision-making based on the needs of a patient and my experiences and skills. My intuition and skills help estimate the requirement and care needs that patients require and guide me in most of my clinical practices. My application of the theory of intuitive decision-making relies on my intuition and other related factors in care delivery. The intuitive decision-making approach comes in when I engage with patients, especially in patient-centered care, to select the care options most suitable for patients. I also engage with my coworkers using the intuitive decision-making approach, especially when working in teams and suggesting possible treatment options. The approach helps provide patient-centered care based on their needs at a particular time and allows for flexibility in care provision. The theory of intuitive decision making suggests that nurses adopt a skilled approach to making decisions and interacting with patients. The proposition of skill acquisition directly improves patient care by ensuring that nurses remain informed and improve their skills. The approach encourages skill learning, practice, and coordination among nurses to optimize their practice in providing guided and informed care to patients. The theory of intuitive decision-making also suggests that continuing nursing education is an integral part of improving the authority of intuition in care provision. The approach is beneficial to patient care because it improves the professional and knowledge base of nurses in providing care to patients. It informs the need for improved expertise and research in the nursing field to improve the quality of care nurses offer to patients. In conclusion, the theory of intuitive decision-making provides an insightful approach to patient care based on a nurse's ability to make effective decisions. The theory provides intricate guidelines on patient handling, nurse expertise, and contextual factors that guide decision-making and care provision. Thank you.